Hi, my name's Megan Den-Hartog.
My name is Alicia.
My name is Tyler Wassam.
I'm Megan. I work here in Springfield at an accounting firm.
I'm just turned 50, so I'm in a different stage in my life, so I'm trying to improve myself for the rest of my life.
I'm a filmmaker in Springfield, Missouri. I've lived in Texas a little bit. I've traveled all over the United States.
I am 34, a nurse at a local Level 1 trauma center here in Springfield, Missouri, and I see Dr. Randi Green.
I had a relatively distressing experience with my first dentist outside of my family's dentist. I left the office literally in tears with a completely unexpected diagnosis and a long list of pretty invasive and expensive procedures, and I had no idea kind of how I had gotten there because from what I understood, my dental health was great. I had gone to every 6-month checkup my entire life. I already had some anxiety around the dentist from some childhood experiences, so it was quite a disaster.
The decision to visit a dentist is a very difficult one. Trying to find someone that I trusted and was comfortable with took about a year's worth of research because I was nervous, I'm uncomfortable, and I don't handle the visit well more or less than putting their hands in my mouth. I had braces when I was younger, and teeth were not very strong, and as I got older, they became much less strong, and I started to lose teeth, and that was really uncomfortable because you didn't smile, you didn't talk to people, and I'm in a customer service kind of environment where I have to talk to people face to face very close. So it took a lot of research and time to determine where I wanted to go and who I felt comfortable with.
When I was 32, I was diagnosed with sleep apnea, and that was with a sleep study. We didn't really delve into why it was happening. I just knew that it was happening. They gave me a CPAP machine. It was not working. I was not feeling better, and I made the decision that I was going to live. I was going to find a way to be healthy and feel well by some stroke of luck or fate or a complete accident, I'm not sure. I overheard a conversation about Dr. Green, and I was like, well, why not just give it a shot and see how it goes.
In 2018, I was filming some videos for the Smile Doctor to go on their Vimeo page and just spread the word about TMD to people that didn't quite know about it. As we were filming those videos, Dr. Green started to list off a bunch of issues that I had been having. It was clicking in my jaw, popping in my jaw, pain in my neck, pain in my back, trouble sleeping, things like that, and I just thought that that was part of getting old. I was like, well, maybe these things can be fixable because that's what Dr. Green was telling me on the video. So whenever we were at lunch, we were sitting around, and I was like, you know, these are the issues I've been having. Do you think that there's something that could help me? And that kind of started the process of getting me into a growth appliance, and it's really shaped up in the past 2 years.
In the past, it's always just been strictly about what your teeth look like and what your diet is, or if you drink too much soda. And when I came here, Dr. Green talked about how your dental system works with your entire body. You can tell that the Smile team really takes their job seriously. They see dentistry as a craft and a science that's always evolving. It doesn't take long after talking to Dr. Green to realize how seriously she takes this and how high their priority is to make sure you have a good experience.
My very first visit, I cried the entire time, from the moment I walked in the door until I left. Scared to death. But it was my scared, not what she did. She made me very comfortable and wasn't judgmental, was very kind and supportive, and says, here's what we can do. Had I not had this implant system done, Zoom would have been very difficult for me. And I'm on Zoom calls all the time. And having a camera that close to my face and not being able to open my mouth and smile would have been awful. It has allowed me to look people in the eye, either in person or in Zoom, present myself in a much stronger way, and I feel different about myself personally and professionally because I'm able to work with people much closer and not be so concerned about what my smile, my mouth, anything looks like.